Dr. Hayden is an exceptionally dedicated, diligent, wonderful leader who capably was a steward for the historic documents in the nation's library, the Library of Congress. And, this is just yet another example of the Trump administration's attempt to whitewash American history, to try to bully and intimidate so that we are not lifting up the facts. Even the ugly truth of American history. And I am so disappointed to see them attacking such a capable leader.
It was interesting to me, Congresswoman, to hear Carolyn Leavitt reference the American taxpayer as though that is the person they are attempting to protect here, especially given the backdrop of Congress currently trying to work out a reconciliation package. I wanted to show you this headline today from the New York Times about the fact that the president seems to be softening on this idea of taxing richer Americans. This is what he said. Mr. Trump wrote on his social media website, Truth Social, Republicans should probably not do it, but I'm okay if they do. What does that tell you about where your Republican colleagues are in their negotiations within their own caucus?
They're going nowhere. They can't agree on anything except for one key mission, which is to pass tax cuts for the billionaires that were in the front row of the inauguration. And they are willing to cut our health care for those tax cuts. They are willing to cut food assistance and basic needs and support for working families for those tax cuts for those billionaires. And so when I hear Donald Trump making these statements, he's just as confused as the American people who are saying, why are you hurting us? And hands off our Medicaid. I think that that statement is irrelevant in these discussions.
Congresswoman, I can't but help juxtapose the abrupt firing of Dr. Hayden last night with what we have seen from ICE officials in Massachusetts and then now today in Newark, New Jersey, where the mayor of Newark, Mayor Baraka, has been arrested. The administration claims he was trespassing, but we have all seen the video. That is not true. And members of Congress were also roughed up. And I Lord knows what would have happened had the members of Congress not been there already for an hour and a half to 2 hours, had already identified themselves as members. Your reaction to this harrowing video and the arresting and detaining of the mayor of Newark today?
What happened at that ICE detention center today is unacceptable, and Mayor Baraka should be released immediately, should not be charged, should have his charges dropped if they've already filed them. I'm not sure exactly where we are in the timeline. But, what is clear is that under existing federal law, members of Congress are allowed admission to all Homeland Security facilities, including ICE detention facilities, whether that visit has been pre-notified or if we just show up on the spot. And we should be welcome. This administration should be treating members of Congress conducting oversight with the transparency that they boast when they appear at that podium. Carolyn Leavitt appears at that podium, or when they make their campaign speeches and rallies, right? This is one of the signature accomplishments of their administration, that they should welcome members of Congress to conduct the oversight that we are accorded under Article 1 of the Constitution.
Congresswoman, you have Politico sticking with the budget conversation a little bit, reporting today that the administration is now, again, going back to the chaos that you referred to in the Republican caucus, targeting a smaller tax package with $1.5 trillion in spending cuts, noting after long-fought battles over cuts to food programs in the Agriculture Committee and Medicaid in the Energy and Commerce Committee, it's become clear to party leaders that they'll only be able to muster $1.5 trillion in spending cuts. And they're still scrambling to hit that number as it is. I've been putting on the table in every conversation, you got to make these cuts. The money's got to come from somewhere. You think Republicans have finally figured out that what's left to cut is something they really can't afford to cut politically? And how do Democrats now find their ability to have that conversation with the American people about what they're seeing Republicans do?
Well, I can tell you that we've been having town hall meetings whenever we're back home. And in my district, we have had thousands of people showing up for these town hall meetings wanting clarity because they're hearing that the administration's seeking to cut their health care, cut Social Security, cut the food assistance that they rely on to help feed their kids. And so, are those cuts politically unpopular? Absolutely. Absolutely. And that's why I think that you see the Republican conference scrambling. They know they don't have the votes, and they know that they can't count on a single Democrat to show up and vote for this mess.
It is interesting to me that in the background of all of this disorder on the legal side as it relates to immigration with the budget, you have Donald Trump still trying to find a surgeon general. His current pick is tearing the MAHA movement apart for figures like former Kennedy running mate Nicole Shanahan and renowned anti-vaccine activist Mike Adams, better known as the Health Ranger. Means is nowhere near extreme enough in her views and is viewed as a, quote, Manchurian asset. As someone who spent a part of your career in healthcare, making sure that you were, in fact, making America healthy, what does it tell you that this is who they have chosen to be the Surgeon General?
I have been deeply dismayed as a registered nurse to see Donald Trump's administration, Health and Human Services Secretary Robert Kennedy, just completely dismantle the singular department that is in charge of protecting the health and well-being of the American people. When they install figures who don't believe in science, who don't believe in vaccines, who traffic in conspiracy theories, who, lift up active misinformation that would only serve to kill more Americans, that has deadly consequences. And I just believe that these people are deeply unqualified. It's dangerous. And, I'm worried for my community because we're expecting to see death rates increase all across the country because people will not have access to the information that they need. The grants are being stopped. These are dollars that fund our health departments, that conduct life-saving research to find more cures, that pay for staff, healthcare providers, and healthcare clinics that keep our rural hospitals open. These are dollars that fund our nursing homes and senior care and memory care in our communities. These people are destroying our public health infrastructure. They are not serious. And unfortunately, the people who suffer are people like you and I.